lot of our health centers, achieving health is really what they've been about for a long time. They have had a designation called a patient-centered medical home, which a lot of our health centers have that designation. And it really just shows that they are interested in really helping the entire person, whether it's their behavioral health needs or dental needs that they have, any medical primary preventative care needs that they have. They've been focused on that for quite a while. So achieving health has been a big deal in our industry for a while, and it will resonate with a lot of our community health centers as they read this. A lot of my community health center clients are really realizing that they need to be working with local partners. They need to be reaching out to community hospitals and to other types of healthcare organizations, because these organizations are also coming to the realization that if the local community health center in my community does well, then my ER numbers drop and my losses in primary care would go down. And all of a sudden they realize that, man, this could be a real win-win. So we're seeing a lot of different healthcare providers reach out to us and say, hey, what kinds of relationships are out there? What's available? What's in accordance with the rules that we can do? And how can this be a win-win for my community? Because we work with so many community health centers across the country, we're able to really give concrete examples of how this has worked. In Texas, we have a community health center that's in the parking lot of a hospital, and how they work together to figure out ways that non-emergent care could potentially be taken over to the primary care clinic, and how they could work together to become a win-win for both organizations. Just examples like that. We've got one in Georgia where they're considering putting a community health center at the end of a long-term care facility. And so we can actually take a lot of these examples where we see home runs, things that have won in different communities, and we can share them with local management teams to say, here's what we've seen work, and provide that way, and then also provide the potholes that occurred during that. Here's the 2 or 3 things they had to work out. So maybe that when they go to their local partnerships, or then when they reach out to other local healthcare providers with potentially reaching out for ideas or reaching out to start relationships, they can go with some examples of what has been a win-win in other communities.